Hello, I'm with Dr. Surin Lord. Dr. Surin Lord is a native of New York City. Her undergraduate degree was earned at Harvard University in Washington, D.C., where she majored in clinical laboratory science. Her medical degree was received from Harvard University, and residency in dermatology was from Harvard University as well. As a board-certified dermatologist, Dr. Surin Lord continued to expand her knowledge in a fellowship in cosmetic surgery, during which she received mentorship from the esteemed Dr. Susan Obeji. At the same time, she filled the role of clinical instructor to dermatology residents at the University of Pittsburgh Medical Center. Dr. Surin Lord is a fellow of the American Academy of Dermatology, as well as the American Academy of Cosmetic Surgery and the American Society of Dermatology Surgery. She serves as an assistant professor of dermatology for Harvard University and has been a sought-after speaker at national conferences. She also shares her expert knowledge in professional publications. Voted a top doctor in the DC metropolitan area, Dr. Surin Lord's philosophy is that each patient should leave her office feeling better about him or herself. Thank you, Doctor, for taking time from your busy schedule to do this recording with us.
Thank you. It was my pleasure.
Dr. Surin, what is Cool Sculpting?
Cool sculpting is a method of body contouring that uses colder temperatures to actually freeze fat cells. And when the fat cells are frozen at that temperature that is used by the Cool Sculpting machine, the fat cells are destroyed, and they're destroyed permanently. And then your body goes in and it naturally cleans out the dead fat cells. Your immune system works that way naturally anyway, by removing old dead cells that it no longer needs. So Cool Sculpting takes advantage of that, and when the fat cells have been frozen and they're frozen dead, as I like to tell my patients, your body goes in and cleans it out naturally, and it's a natural way of fat removal. And how that's done is, as long as you can pinch the fat, and we actually have fat we can pinch, a cooling plate is applied. There's a vacuum. It vacuums, it sucks the skin in there and the fatty tissue, and it takes the temperature down. And at that temperature, where research has been shown that fat cells are destroyed, the fat cells are destroyed, but the overlying skin remains intact. There's no puncture, there's no surgery, and the fat is destroyed. And Cool Sculpting was developed because they found that children who sucked on popsicles or kept them on one side of their cheek developed dimples. And then, equestrians who were horses during the winter, well, they had slimmer thighs. So why not then take that technology and use it to our benefit and use Cool Sculpting to actually get rid of excess fat, exercise-resistant fat, and stubborn fat. So that's how Cool Sculpting works. That's why it got the name Cool. It uses the cold as opposed to other forms of fat removal.
Where does the fat go, doctor, and are the results permanent?
So where does the fat go? When they're frozen, they go through a natural cell death called apoptosis, which we learn in biology. Apoptosis just means cell death. So your immune system goes in and it gobbles up the dead fat cells, and they're microscopically eliminated through the urine. It's not that you get a greasy urine or a fatty urine or anything. It's just microscopically eliminated that way. And is it permanent? Yes, it is. Because once those fat cells are destroyed, they're dead. Remember, they're gone, and your body cleaned them out and eliminated them. So the fat from that area is removed, and about 25% of the fat in an area treated by Cool Sculpting is removed. This is why this sort of fat removal and body contouring, why it's so phenomenal and why it's so popular, why over 1.5 million treatments have been done worldwide, is because it is non-invasive, it is effective, and it is permanent.
Is the Cool Sculpting procedure safe?
Yes, it is. Cool Sculpting is FDA cleared, And to be FDA cleared, you have to show that, one, you're effective, and two, that you're safe. You can't be safe and not effective, and you can't be, effective and not safe. So yes, it is safe. There have been over 1.5 million treatments worldwide. There are really no contraindications or conditions preventing people to get Cool Sculpting. There's a patient consent form that one fills out with Cool Sculpting. We take a thorough history. We make sure that people are pretty healthy and pretty fit to get Cool Sculpting. The thing is, what makes Cool Sculpting so wonderful is that people who are not surgical candidates, let's say somebody is not stable enough to get liposuction, or is not a great liposuction candidate, well, guess what? Cool Sculpting is non-invasive. It's no surgery, no anesthesia, no downtime. You can walk in, get it done, and go on with your daily activities as normal. You can even go work out afterwards. So Cool Sculpting is very safe. It just needs to be performed by, someone who's been trained in Cool Sculpting, someone who's certified in Cool Sculpting. Our practice is certified and preferred. And so as long as the people are experienced in Cool Sculpting and they're a legitimate Cool Sculpting center, it's pretty safe.
Are there any side effects, doctor?
There are side effects to anything. There are side effects to even putting on certain creams or anything. I'd say there's a potential in Cool Sculpting for different reactions after you have the treatment. And why I say the potential is because everyone's different. Everyone's pain tolerance is different. Everyone's comfort or discomfort level is different. Someone who's had cosmetic procedures performed before may say Cool Sculpting is a breeze. I have people who've had, if they've had tummy tucks or breast augmentation or anything else, and they come for Cool Sculpting, they're like, oh my gosh, that was easy. That's nothing compared to what I've done. And you have somebody who, who's never had anything done before, and this is their first cosmetic procedure, or their first body contouring procedure, they're going to feel a little cramping. So side effects of Cool Sculpting, I really want to call them reactions. I don't want to call them side effects because they're not really side effects. After treatment, one may experience abdominal itching if the abdomen is treated, and that's because the abdomen contains a lot of histamines, and sometimes when you do procedures in the abdomen, you may experience itching. So it's a sort of deep itching that one might get, that you're itchy but you really can't get to it, and that subsides. It occurs about maybe 3 to 4 days after the procedure, and it subsides. And sometimes people get a cramping feeling, and the cramping, again, it depends on the patient's tolerance, et cetera, but that starts around day 3 or 4, and that subsides in about 2 weeks. The thing that I love about Cool Sculpting, again, because it's non-invasive, is that we really don't require narcotics, we don't require any heavy-duty pain management for it, but for the person who is uncomfortable, there are other things that we can do or prescribe. Being an MD and a dermatologist, there are things that I can prescribe to alleviate that. The other thing might be that some people may get swelling in an area of treatment. I notice that the upper abdomen sometimes swells, and if you get swelling, it can last about 2 to 3 weeks. So you're not going to see those results that you're hoping to see in the reduction in inches. If you get swelling, you're not going to see them right away. It's going to take a little while for you to see them. The other thing may be a little bruising from the suction. So if somebody takes an aspirin once a day, if they take ibuprofen for pain, all those things are blood thinners. Any vitamin E or anything like that, you may see a little bruising afterwards, but like a regular bruise, it resolves in 7 to 10 days. So you can see how the possible reactions after Cool Sculpting therapy are really minimal, and they're manageable. So those are pretty much what we see with Cool Sculpting.
Who should not have the Cool Sculpting procedure, doctor?
Anyone who is pregnant should not have Cool Sculpting procedure. There is a concern about, or concern for anyone who has a pacemaker or defibrillator on there. And then the other people who should not get Cool Sculpting are those who are on some blood thinners like Coumadin or Xarelto, again, because of the pinching. you may get a little collection of blood, a hematoma, or a big bruise, and that resolves on its own. But for those patients, if they really wanted that procedure, they can talk to their doctor, the person who put them on the blood thinner, and discuss if it's okay to get off of it for a couple of days and then get their treatment, and then they can resume. So I think right now those are the people who shouldn't get it under those conditions, but definitely no one who's pregnant. So there is also a concern about a patient who may have Raynaud's phenomenon. Raynaud's phenomenon is when one is exposed to cold temperatures and they get blanching or whitening of the fingertips or certain other areas of the body. Now, that's not to say that people who get Raynaud's can't get Cool Sculpting. It just depends on the severity of the Raynaud's, the areas that they get it, and that, of course, all that history is taken at the time of consultation, and those questions are answered then. So that's just a concern. It's something to discuss with the person who's performing the Cool Sculpting, just to keep that in mind.